Start our discussion on suspensory muscle of duodenum, also called as ligament of Treys. So actually, first let us draw duodenum. Okay, till here it's duodenum. Here starts jejunum. So this is duodenal jejunal flexure. Okay, and here you'll have esophagus. Okay, this muscle will be coming like this, and here you'll have suspensory. Yeah, here you'll have right crus of diaphragm. So this is right crus of diaphragm, and this is our suspensory muscle, that is ligament of Treys, and this is esophagus. And here in the middle you'll have the celiac trunk. Back of it you'll have abdominal aorta, outline of aorta. So now I think you understood this muscle. Now let us start about this. Actually this muscle is you can see it's a fibromuscular band which is suspending from the support of duodenojejunal flexure. It arises from the right crus of diaphragm close to the right side of esophagus, and it passes downward behind pancreas, and it is attached to posterior surface of duodenojejunal flexure and also to third and fourth part of duodenum. You know, this is the first part, second part, third and fourth part of duodenum. So this muscle is attached to third and fourth part of duodenum, and it is mainly made up of striped muscle fibers in upper part. So in upper part, striped muscle fibers. Here striped muscles in upper part, and it is having elastic fibers in the middle part. So here elastic fibers, and next in the lower part it is having plain muscle. Here it has plain muscle in lower part. Now normally during its contraction it increases the angle of duodenojejunal flexure, and then its contraction may narrow to the angle of flexure, causing partial obstruction of gut. So whenever it is contracting, then this will get dilated more. Whenever it is getting relaxed, then this it will lead to obstruction of this duodenojejunal flexure. Now let us discuss about the arterial supply of duodenum. So actually first you will have the celiac trunk here. So from the celiac trunk arises the hepatic artery. From the hepatic artery you will get many branches. The first one is supraduodenal artery, and you will get the right gastric artery, and also you will get superior pancreaticoduodenal artery, this one. Superior pancreaticoduodenal artery, and also this will divide into right gastroepiploic artery, and here you will have superior mesenteric artery, and it's branch like this. So let us name all the arteries now. So first this is the celiac trunk, this is the hepatic artery, and here comes this one, supraduodenal artery, and this is right gastric artery, and this is gastroduodenal artery, this is superior pancreaticoduodenal artery, and this is inferior pancreaticoduodenal artery, and this is superior mesenteric artery, and this is right gastroepiploic artery. So these are the different arteries around the duodenum. Now let us see how the duodenum develops. Actually, it develops partly from foregut and partly from midgut. So the opening of bile duct into the second part of duodenum represents the junction of foregut and midgut. So up to the level of opening, the duodenum is supplied by superior pancreatico-duodenal artery. So this superior pancreatico-duodenal artery is supplying up to the foregut part of duodenum. Midgut part of duodenum is supplied by other arteries. Okay, and below it, like below means it is in the midgut. In the midgut part of duodenum, it is supplied by inferior pancreatico-duodenal artery. So this one, inferior pancreatico-duodenal artery, supplies this part. Superior pancreatico-duodenal artery supplies up to the foregut part of duodenum. And next, coming to the first part of duodenum receives additional supply from right gastric artery. So this right gastric artery also supplies the first part of duodenum. And coming to supraduodenal artery of Weddell. So supraduodenal artery of Weddell usually branch of hepatic artery, and next you have retroduodenal branch of gastroduodenal artery. So this is gastroduodenal artery, right, which is branch of gastroduodenal artery, retroduodenal artery, and some other branches from right gastric epiploic artery. So this is right gastric epiploic artery. So all these different types of arteries supply the duodenum. Remember that till here it is a part of foregut, till here it is part of midgut. The foregut part is supplied by superior pancreatico-duodenal artery. The midgut part of duodenum is supplied by inferior pancreatico-duodenal artery. Now let us discuss about venous drainage. So venous drainage of duodenum is mainly it is draining into splenic, superior mesenteric, and portal veins. Next, coming to lymphatic drainage, most of the lymph in the duodenum it ends in pancreatico-duodenal nodes, pancreatico-duodenal lymph node, which is present inside the curve of duodenum at junction of pancreas and duodenum. So from here lymph passes into hepatic nodes. Okay, from there it will pass into celiac nodes and partly to superior mesenteric nodes. Okay, and ultimately via intestinal lymph trunk into cisterna chyli. So sometimes first part of duodenum may drain into the pyloric nodes. Okay, and from pyloric again it will enter this route to hepatic lymph nodes, or some other parts of duodenum may sometimes directly drain to celiac nodes. From there finally they'll reach the cisterna chyli. So whatever the path of lymphatic drainage, they'll finally reach to cisterna chyli. Okay, so now coming to the nerve supply of duodenum. The nerve supply is by T9 and T10 spinal segments, and also by these are sympathetic, and also by parasympathetic, like by means of vagus, which pass through celiac plexus and reach duodenum. Okay, celiac plexus, this is parasympathetic. T9 T10 sympathetic. So finally let us discuss about clinical anatomy related to duodenum. Okay, so first one is we use skiagrams. So to use it we need to give barium meal. After barium meal we use skiagram to find the triangular shadow in first part of duodenum, and it is seen as duodenal cap. Okay, next coming to second point, that is first part of duodenum is most common site for peptic ulcer, and it is because of direct exposure of acid from stomach. Next coming to over busy young person with some stress, increased stress, have ulcer pain in right epigastrium, and it will be relieved after taking meals. Okay, in empty stomach they'll have pain in the right epigastrium. Next, coming to the first part of duodenum, it is overlapped by liver, gallbladder, and they both, either liver or gallbladder, may sometimes even become adherent to first part of duodenum. So as I said, first part of duodenum is most common to peptic ulcer. So peptic ulcer from this first part of duodenum may also spread to liver or gallbladder because they are nearby to it. Next, coming to duodenal diverticula. So duodenal diverticula are like frequent. They are seen along concave border and where arteries enter the duodenal wall. Okay, this concave border only arteries will enter. Next, coming to congenital stenosis. Congenital stenosis that is nothing but obstruction of a second part of duodenum. Okay, second part of duodenum at opening of bile duct. So other causes of obstruction may be due to annular pancreas, due to pressure by superior mesenteric artery, contraction of suspensory muscle of duodenum. All those may be causes for congenital stenosis in second part of duodenum. So you can see some causes like for the secondary this congenital stenosis in second part: annular pancreas, pressure by superior mesenteric artery, contraction of suspensory muscle of duodenum. So by this we have completed our anatomy of duodenum. You can see here this is a radiograph of stomach after barium meal. Note the duodenal gap. So gas in the front, the stomach filled with barium meal. You can see the duodenal gap clearly in the sciagra. So next we'll start with jejunum and ileum.